Welcome to Dissemination and Assessing Implementation of the EULAR Recommendations for Patient Education for People with Inflammatory Arthritis across Europe. My name is Dr. Sarah Bennett. I'm a Research Associate at the University of the West of England in Bristol. I'm presenting on behalf of my colleagues Heidi Zangi, Astrid van Tübingen, Medimi Endosi, and our study collaborators. Patient education can be defined as a planned interactive learning process designed to support and enable people to manage their life with inflammatory arthritis and optimize their health and well-being. EULAR recommendations for patient education in inflammatory arthritis were published in 2015. Development of recommendations is one thing, but whether these recommendations will be accepted and implemented is what will truly make a difference. Implementation of the EULAR recommendations into daily clinical practice is vital for the desired changes and quality improvement to happen. The aims of this research were threefold: disseminate the recommendations to all stakeholders, assess the level of acceptability of the recommendations, to assess applicability in clinical practice, including potential barriers and facilitators to their application. This cross-sectional multinational study used an online survey, with items developed in English, translated into 20 different languages, and distributed by our research partners to health professionals using snowball sampling across all these countries in Europe and Asia. This included 10-point rating scales assessing the level of acceptability and applicability of each of the 8 recommendations, and text data boxes which allow participants to give reasons for disagreeing and barriers to implementation of the recommendations in practice. Descriptive statistics summarized agreement and applicability levels, and textual data were analyzed using content analysis. EULAR recommendations for patient education are that it should be provided as an integral part of standard care, offered throughout the course of the disease, tailored to individual patients and needs-based. It can also be provided through different modes, such as face-to-face, group meetings, or online. Patient education should be based on theoretical framework and underpinned by evidence. The outcomes of patient education should be evaluated, and recommendations are made for competency and training in delivery. We looked at median and interquartile range scores for whether health professionals agreed with the recommendations. The level of agreement was high across all recommendations with a median score of 10. However, the level of applicability was variable, generally lower compared to each corresponding agreement level. In particular, for recommendation 6, which states that the effectiveness of patient education should be evaluated, the lack of an effective evaluation tool was the biggest barrier to implementation. For the qualitative results, the 3 most common barriers to application were a lack of time within appointments and in other patient education activities, a lack of training in how to provide patient education, not having enough staff to provide patient education, and in addition, a lack of phone or internet resources to provide patient education in recommendation 4, and for recommendation 6, a lack of an effective evaluation tool. In conclusion, this project has successfully disseminated the EULAR recommendations for patient education across 23 countries. There was high agreement with the recommendations among health professionals, but application to clinical practice was lower. Some barriers to application are amenable to change, and addressing these will help to improve practice. This work would not be possible without the fantastic collaboration across all these countries, funding from EULAR, and support from the Standing Committee of Health Professionals. Our sincerest thanks to all those who made this research possible.